Hi everybody, I wanted to make this video for you because some of you are having difficulty understanding the stages of pregnancy as indicated in your Module 3, Assignment 3 quiz. I'm noticing that many people are not doing well on that, so I thought I would take time to briefly run through the different stages of pregnancy and development. I think you're going to find it interesting because I've tried to get pictures from 4D sonograms so that you can actually see the development of the baby and the things that I'm talking about. So let's get started. During the first trimester, right at conception, things begin to happen in the growth and development of a human being. To begin with, at conception, all of the DNA, all of the instructions and the coding that are going to make that baby a unique individual and human being are all right there. So as soon as that sperm fertilizes the ovum or the egg in the mom, that baby begins to grow and develop, and all of the things that make that baby unique are there. The embryo from that point begins to move down the fallopian tube. It embeds into the wall of the uterus where the umbilical cord is formed, the placental sac is formed, the amniotic fluid is formed, and the baby is now protected and ready to grow and develop during all of the stages of pregnancy. The awesome thing is right from the beginning, the very first thing that begins to develop is the baby's heart and brain and nervous system. And other vital organs begin to develop during the first trimester by the end of the third week as well. But right from the beginning, the heart begins to form. And at day 22, the heart actually begins to beat with the baby's own blood. At week 4, the brain and spinal cord has begun to form. You can see here these tiny vertebrae of the spinal column that are protecting the spinal cord. The heart again has begun to form and actually beat. You can also see that arms and legs are beginning to develop and clearly seen in this sonogram. And by week 8, all of the major organs have formed to some degree. The heart, the liver, the kidneys, the lungs, the brain, the spinal cord, and nerves are actually beginning to go from the brain down the spinal cord and out into these little arms and legs and other parts of the body. Fingers and toes are forming. You can't really see them yet, but they are beginning to form. And sex organs are also beginning to form. And facial features are becoming more evident. You can see that the eyes are beginning to develop, and the umbilical cord that attaches the baby to the wall of the uterus where it can get all of the nutrients it needs from the mom has formed and is connected at what we call the belly button. In week 12 of the first trimester, which is the end of the first trimester, you can see that now the fingers are fully developed. So that was pretty quick. In 4 weeks, you have these very distinct and defined fingers and toes. The eyes and facial features are developing more and more. Nerves and muscles actually begin to work together, and the baby can make a fist or grasp objects like the umbilical cord. Sometimes if the baby's hands brush against the umbilical cord, they'll reach out and they'll touch it. The sex organs show, and you can tell at this time if the baby's a boy or a girl. The baby has teeth. A skeleton is beginning to form, a circulatory system, and you can see those little blood vessels right here that have formed as the heart pumps blood through the body. The nervous system is fully formed, and the baby has nerves. The thalamus and brain tissue has formed, and the baby actually feels and reacts to pain and pressure in the womb. Fingernails are developing, vocal cords are complete, and the baby begins to breathe amniotic fluid. And here's a great fact, an interesting fact. The baby's kidneys actually function, and the baby begins to urinate in the womb. So what can go wrong during the first trimester? Well, lots of things actually. This is the most critical time during prenatal development, and it is where 99% of all birth defects occur. And this is largely due to things, choices, and behaviors of the mother during pregnancy. The baby is at its most vulnerable to drugs, alcohol, tobacco, and toxic substances that may be found in the environment from pollution and those kinds of things. As I said, most birth defects occur during the first trimester of pregnancy, and what the mother does can have a dramatic impact on the health and the development and the growth of the baby. So making good choices, staying away from drugs and other substances, give the baby a healthy start in life. And the reason this is so is because all of those vital organs are formed during this stage. During the second trimester, which runs from 13 to 28 weeks, a lot of things begin to happen. The musculoskeletal system, which are the muscles and the bones, actually begin to work together, and they are continuing to form and becoming more fully developed. In fact, in the long bones of the arms and the legs, bone marrow is forming. The skin begins to form, and it is kind of a translucent, and in other words, a clear color. A substance called meconium develops in the baby's intestinal tract, and it's going to be the baby's first bowel movement when they're born. Babies will begin practicing nursing, and this is called the sucking reflex. It's a very, very important reflex to occur in prenatal development, as it indicates brain function and the ability of the baby to actually nurse when it's born. The heart now pumps several quarts of the baby's own blood through its body each day, and the taste buds are fully developed, as fully formed as they're going to be throughout the life of this individual. At 20 weeks, the baby's more active, and you can see very, very, very defined uh, facial features. The baby will begin to kick, and probably has before this, but it's going to be very noticeable by the mom at this point. The baby experiences periods of REM sleep, and they begin to dream. The baby's covered with a fine feathery hair that's called a lanugo, and a waxy protective coating called a vernix. Eyebrows, eyelashes, and fingernails are forming, and fully formed toenails and fingernails, and the baby can even actually scratch itself. Another interesting fact is that the baby can actually hear and swallow and will respond to the mother's voice. Glands begin to function as well at this point. At 24 weeks of the second trimester, the baby's bone marrow begins to make blood cells. This is really important because that bone marrow will continue throughout your life to make red blood cells and white blood cells that are critical for your function and your health. Those taste buds now begin to form on the baby's tongue, and here's a cool thing, footprints and fingerprints are formed. Hair begins to grow on the baby's head, and if you look really closely here, you can see eyebrows that have formed. The lungs are formed, but they're not working yet because the baby isn't ready, actually, to begin breathing air. The baby has a regular sleep and wake cycle, which is really pretty cool and interesting. And it usually follows the cycle of the mother. Not always, though. At this point, those sex organs are fully developed in the baby, and if it's a boy, the testicles begin to descend into the scrotum. If it's a girl, then her uterus and ovaries are in place. And here's a cool thing, a lifetime supply of ova or ovum eggs have formed in the ovaries. Going into the third trimester, which lasts from 29 to 40 weeks, Here at 32 weeks, you can see that this baby has a full head of hair. All of the facial features are completely formed. You can see the ears and the nose and the mouth. It is a fully formed little baby. You can see the fingernails right here. And of course, we don't have a good enough view to actually see the fingerprints, but as I said, they are fully formed. The movements increase of the baby. The baby's bones are soft, but they're fully formed as well. The eyes can open and close, and the baby begins to practice breathing movements, even though the lungs continue to develop. In fact, the lungs are actually the last vital organ to develop uh, in a baby before they're born. That's one of the things that happens if a baby is prematurely born that they struggle with is that the lungs aren't fully formed, and so uh, that takes some real care from neonatal physicians and nurses to help that baby breathe until those lungs can develop and the baby can breathe on its own. The baby's body begins to store minerals like iron and calcium, and that little fine hair begins to fall off the body in preparation for birth. Now, interesting, as a hair falls off, that protective waxen coating called the vernix actually begins to thicken. And the reason it does is it's beginning to coat the baby's body and skin so that it can move more easily through the birth canal when it's born. The baby's getting bigger, and as you can see, it fills up the uterus and the placenta, and it has a lot of less space to move around. During the last few weeks of the third trimester, 37 to 40 weeks, the baby is fully formed and can come at any time. Usually, a full term is 40 weeks, and most babies will go full term. However, if the baby is born anytime during 37 to 40 weeks, it will be able to live and breathe and function fully. The baby's organs are capable of functioning on their own. And as a mom reaches closer to the due date, the baby will actually do a complete turn in the womb in a head down position where the head is right up against the pelvic bones, getting ready to be born. An average birth weight baby is between 6 pounds 2 ounces to 9 pounds 2 ounces, and of course that does vary depending on the baby. An average length is 19 to 21 inches long. So those are the stages of prenatal development. There's a lot that goes on. I thought it was pretty cool to see some of the pictures of sonograms of actual babies growing and developing in the womb. I hope this helps you to understand the processes and the things that do happen as a baby goes through those stages of development and the stages of pregnancy. And thanks for listening.